today is October 13th, 2016. My name is Mary Griffin, and I'm going to be the examiner, and this is...
I'm Chenjia Liu.
And she is going to be the examinee. Okay, Chenjia, how are you doing today?
I'm good, how are you?
Good. Okay, we're going to start off just seeing how your lips move and how you can make some sounds. So the first one we're going to do is, can you say puh for me?
Pa.
Okay. So what we're going to do is you're going to say that as fast as you can for just a few seconds. I'm going to see how long it takes you to say it.
Okay.
Okay, so you're going to go puh, 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 puh.
Pa, 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 pa.
Okay, ready?
Yes.
Okay, go. Okay, thank you. Okay, so we are going to do the same thing with tuh. So you're going to say tuh, 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 as fast as you can, okay? Ready?
Yeah.
Okay, go. Okay, good, thank you. Okay, now we're going to say the exact, or do the exact same thing with k. So we're going to go k, 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 k. Okay, ready?
Yes.
Alright, go. Okay, thank you. Okay, now what we're going to do is combine all of those. So we're going to do pataka. So you're going to say it as fast as you can. Ready?
Yes.
Okay, go. Okay, good. Thank you. Okay. So next what we're going to do is the oral facial exam. And for that, I'm just going to get some Germex. Put some gloves on. And while I'm doing this, I'm just going to check out your face a little bit. Just see how you are. Okay, good. Okay. Now, first I want you, can you open and close your mouth for me? Hot, and then close. Good. Can you do it a couple more times for me? Very good. Okay. So now can you open your mouth pretty wide for me? I'm just gonna take a look and look at all your teeth. Very good. They're all there, which is nice. Okay. Now can you pucker your lips for me like you just tasted something sour? Yeah, very good. Very good. Now I'm gonna press this tongue depressor against them, and you're just gonna try to keep them strong and not let me push, okay? Good. Okay, so can you pucker them again for me? And then go to a smile. Big smile, nice smile. Good. Thank you. I'm gonna wipe that up. Okay, so now can you puff out your cheeks for me? Hold in some air. Okay, and I'm just gonna see if I can push them in. So try not to let me, okay? Very good. Okay, so now what I'm gonna do is see if any air comes out your nose. So just puff up your cheeks again, hold in some air. Very good. Okay, so now if you could open your mouth wide for me again, I'm just gonna take a look at your tongue. Looks good. Okay, now can you stick out your tongue a little bit for me, or as much as you can? Okay, thank you. Okay. Now I'm gonna stick this tongue depressor against your tongue like we do with your lips, and you're gonna try not to let me move it, okay? So stick out your tongue. Good job. Okay, can you pull your tongue back in your mouth? Open your mouth so I can see it. Good. Good. Okay, now can you stick out your tongue to the right for me, please? As far as it can go. Good. Okay. And I'm gonna do the tongue depressor against that. So stick it out to the right again. Okay. Good. Okay. And can you do that to the left now? And I'm gonna try the tongue depressor against it again. Good. Okay, now can you do those back and forth? Stick your tongue out and do it to the right, to the left. Very good, thank you. Okay, now can you move your tongue up like this? Good, thanks. Okay, and can you do the same thing down? Good, thank you. Okay, so now I'm going to, I did it out of order. Can you move your tongue side to side for me again? Very good, thank you. Just wanted to double check that. So now, could you open your mouth again? And I'm gonna take a look at all of the structures you've got going on there, the hard and soft palate. I don't mean to blunt you, I'm sorry. Very good. Now what I'm gonna do is I'm gonna look in your mouth while using a tongue depressor, and it's normal to feel a gag reflex, so don't feel shy about it, okay? Okay, very good, thank you. Okay, now could you open your mouth big and wide and say ah for me, as long as you can. Okay, good. Thank you very much. Okay, and that was the oral mech exam. Thank you very much.
Today is October 13, 2016, and we're doing the oral mech exam. My name is Camille Molineux. I'm the examiner, and this is...
I'm Chenjia Liu.
And she's my examinee. Hi, how are you doing today, Chenjia?
Good, how are you?
Good. Well, I'm just going to be having you do a few exercises for me, okay?
Okay.
And I'm just going to be using this over here to just measure a few things, okay?
Mm-hmm.
So can you say pa for me?
Pa.
Good. Now I want you to say pa, 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 just like that, as fast as you can and as accurately as you can, okay?
Okay.
So I just want you to do that until I say stop, okay?
Okay.
Okay, ready, go. Stop. Good. Okay, now I'm gonna have you do the same thing with ta, okay? So the same thing, can you say ta?
Ta.
Now I want you to go ta 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 until I tell you to stop, okay?
Okay.
Okay, ready, go. Stop. Good. Okay, now we're gonna do the same thing with ka. So can you say ka? Guys, we're gonna ka 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 ka. So I'm gonna say ready, go. Good. Stop. Okay, now this one's a little different, okay? So I'm gonna have you put all those together and say pataka. Good. You say that as many times as you can and as accurately, okay? So pataka, 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 pataka. Okay. Ready, go. Good. Okay. Now we're going to move on to the oral facial examination, okay? So I'm gonna put some hand sanitizer on. And I'm just gonna be looking at your face and your tongue and your lips, just making sure everything looks okay. And then I'm gonna put these gloves on. So the first thing I'm gonna do is just look at your face and make sure everything looks symmetrical. Everything looks fine with your jaw. There's nothing drooping to one side. There's no abnormal movements. Everything looks good. Okay, now I'm gonna have you open your mouth as wide as you can. Okay, can you shut it for me? Can you open it and shut it? Good. The range of motion's good. It's very symmetrical. Didn't hear any noises with your jaw. Okay, I'm just gonna get this light. I'm gonna look at your teeth, okay? Can you put your head up a little bit? Good. Can you smile for me? And open your mouth. I'm just gonna looking at the side of your teeth. Okay, everything looks good. Okay, can you pucker your lips for me like this, like you're kissing something? Good. I'm gonna get this tongue depressor here. Want you to pucker your lips, and I'm gonna try and push this against your lips, and I want you to keep them really strong, okay? So I don't want you to let me press your lips in. Good. Okay, I want you to smile. Good. Can you smile? Show me your teeth. Good. And pucker and smile. Good. Okay, now I want you to pull air up in your cheeks like you're getting ready to blow a bubble. Now I'm gonna press your cheeks, okay? And I want you to keep me from pressing that air out of your cheeks, okay? Good, nice strong lips. I want you to do the same thing. I'm gonna put this mirror underneath your nose, okay? So I just want you to puff your air up like you're gonna blow the bubble. So do that, and I'm gonna put this right underneath your nose. Good. Okay, I'm gonna look at your tongue. The color looks good and normal. There's no movements. The size is good. Can you open your mouth up again? Just pull your tongue up to the top of your mouth. Okay, now I just want you to stick your tongue out. Okay, can you stick your tongue out as far as it can go? Okay. Okay, I'm gonna put this on your tongue. Stick your tongue out, and I'm gonna I want you to keep your tongue strong and keep me from putting it back in your mouth, okay? Good. Okay, can you stick your tongue back out again? And I want you to stick it back in your mouth. Okay, can you stick your tongue and try and touch your nose? Okay, try and touch the bottom of your chin. Good. Okay, can you stick your tongue up to the right? Good. Okay, I want you to stick your tongue over to the right side. And I'm gonna try and press this with my tongue depressor, okay? I'm gonna see your strength in your tongue. Good. And I'm gonna do the same thing to the left side, okay? So I want you to stick your tongue up and then put it down. And then stick your tongue back over to the left. I'm going to put this tongue depressor on there. Good. Can you stick your tongue up and down? Okay, and now I want you to go side to side with your tongue. Can you stick your tongue out just a little bit? Now I want you to go side to side. Okay? I'm going to look in your mouth one more time, just looking at your hard palate, your soft palate, everything in your mouth looks good. There's no growth or cleft. Okay, I'm going to stick this tongue depressor in your mouth, and it's going to go far, okay? You're going to feel a little bit of like a, okay? Okay, now I want you to say, ah. You say, ah, as long as you can go. Good. Everything sounds good? You do that one more time. I'm going to look in your mouth when you say it, okay? So open your mouth a little bit more. You say, ah. Good. Okay, Chenjia, we're all done today. Thank you.
Good morning. Today is October 21st, 2016, and I'm the examiner of today. I'm Chenjia Liu, and this is my examinee.
Mary Griffin.
Hi, Mary. How are you today?
Good, how are you?
Good. Now I'm going to let you say some sounds, and you will try to say it as quickly as possible and as accurately as possible, okay? And I'm going to count. Okay. Yes. And the first sound is the pa, pa. Good. Can I say pa, 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 pa? Good. Now say it as quickly as possible. Are you ready? Okay, go. Pa, 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 pa. Good. Stop. morning. Today is October 21st, 2016, and I'm the examiner, Chenjia Liu. This is my examinee,
Camille Molineux.
Hi, Camille. How are you today?
Good. How are you?
Good. Now I want you to say some sounds, and you will try to say them as quickly as possible and as accurately as possible. Okay? Can you say pa?
Pa.
Good. Can you say pa pa pa?
Pa pa pa.
Good. Now are you ready to say more times for it? Okay. I'm going to say go and you can start. And
Okay.
I will say stop and then you can stop.
Okay.
Okay, you ready? Go.
Pa 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 pa.
Stop. Okay, thank you. The next one is ta.
Ta.
Can say ta ta ta.
Ta ta ta.
Good. Okay, you ready? Go.
Ta 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 ta.
Stop. Thank you. Now can you say ka?
Ka.
Can you say ka ka ka?
Ka ka ka.
Good. Okay, are you ready? Go.
Ka 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 ka.
Stop. Okay. The last one is pataka. Can you say that?
Pataka.
Good. Say it as quickly as possible again.
Okay.
Ready? Go.
Paraka 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 paraka.
Stop. Thank you. Okay. Next, I'm going to see the structures in your mouth and on your face.
Okay.
Now I'm going to sanitize my hands. Put the gloves on. Later, I'm going to ask you to do some tasks. You will just try your best to do them.
Okay.
Okay. Okay. Now, can you look at me? Just to sit still. Okay, good. Open your mouth and close your mouth. Can you smile? Good. Okay, good. Can you open your mouth for me again? Thank you. Can you look a little bit awkward? Okay. Okay, thank you. Can you do what I'm doing? Now I'm going to press the tongue depressor against your mouth, against your lips. Just try to move. Don't let my. Okay. Can you protrude a little bit harder? Okay. Now can you smile again? Okay. Good. Now can you puff your cheeks? Good. I'm going to touch your face with my hands. Okay. Okay, can you puff again? Okay, try to let my hands brush you. Okay. Thank you. Okay, puff your cheeks again. I'm going to put a mirror in your nose. Thank you. Can you open your mouth again? I'm going to look at your tongue. Good. Okay. your tongue tip up. Okay, thank you. Now, can you stick your tongue out? Okay, just to stick forward to me. Can you stick it again? Okay, thank you. And protrude your tongue again. Okay, and retract it back. Okay, thank you. Now move your tongue tip to the right. Protrude it and to the right. Okay. Okay, you can retract it. Move your tongue tip to the right again. I'm going to use tongue depressor. Okay. Thank you. Okay. Now move the tongue tip to the other side, to the left. Okay. Okay. Try to press my tongue depressor. Okay. Now stick your tongue and move the tongue tip up. Move it down. Okay, thank you. Now move your tongue from left to right as quickly as possible. Okay, good. Thank you. Okay, now open your mouth again. Can you say ah?
Ah.
Okay, can you say one more?
Ah.
Okay, good. Thank you. Okay, now open your mouth again. I'm going to touch your tongue with my tongue depressor. Okay. Okay, that's it for today. Thank you very much. Thank you.
Hi, it is October 21st, 2016, and today we're doing our oral mech exams. I am the examiner. My name is Mary Griffin, and this is
Camille Molineux.
who is the examinee. Okay. So hi Camille, how are you doing today?
Good. How are you?
Good. So what we're going to start off with first is we're going to see how well you say a few sounds. And what you're going to do is you're going to say them as quickly as possible, and just do the best you can. So we're going to start off with puh. Can you say puh, puh? Very good. Okay, so can you say it a couple times? Puh, 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 puh. Good. So you're just going to do that as fast as you can until I tell you to stop.
Okay.
Ready?
Mm-hmm.
Okay, go. Puh, 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 puh. Good. Okay, so now we're going to do the same thing with tuh. Can you say tuh, tuh? Okay, can you say it a couple times for me? Tuh, 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 tuh. Good. Okay, so now I'm going to tell you to start and stop.
Okay.
So just do it as fast as you can. Ready?
Uh-huh.
Good. Okay, so now we're going to do the same thing with cuh. Okay?
Cuh.
So cuh, cuh, cuh.
Cuh, 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 cuh.
Okay, ready?
Mm-hmm.
Go. Cuh, 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 cuh. Good. Okay. So now what we're going to do is we're going to put all those together and say pa-ta-ka, pa-ta-ka. Good. So you're going to say that as quickly as possible until I tell you to stop.
Okay.
You ready?
Mm-hmm.
Go. Paraka, 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 paraka. Good. Okay, very good. Thank you. Okay, so next we're gonna start our oral making statement. I'm gonna put some hand sanitizer on and some gloves. While I'm doing that, I'm just gonna take a look at your face while you're just sitting. So just stay still. Very good. Sorry, these are a little difficult to get on. Okay, very good. Okay, so now could you open and close your mouth for me as wide as you can? Very good. Close it. Good. Okay. So now could you open your mouth again? Good. Very good. Got all your teeth.
Good.
Okay, so now could you pucker your lips for me? Yeah, very good, just like that. And what I'm gonna do is I'm going to press this against them and try to not let me press it against them. Okay, try not to. Okay, can you try that again? Okay, thank you. Okay. Could you give me a smile? Very good. Smile. Good. Okay, now could you puff out your cheeks? Okay, what I'm gonna do is I'm gonna press against them, and you're gonna try to keep the air in your cheeks. Okay? Okay. Control it again. Now I'm gonna look at this mirror and see if any air is coming out of your nose. So puff your cheeks up again. I'll just see. Good. Okay. So can you open your mouth more so you can look at your tongue? Very good. And can you lift your tongue up? Good. Now I'm gonna get you to stick your tongue out as far as you can. Good. Good. Stick it side to side. You do side to side for me. Okay, and then retract your tongue. Alright, there we go. Okay, now can you stick your tongue to the left? And I'm gonna stick this tongue depressor instead, and we're gonna see how strong your tongue is. Okay? Good. Now we're gonna do the same thing to the other side. Okay? Good. Great. Now can you stick your tongue up towards your nose and try to touch your nose? Good. Great. Now down. Good. Okay. Side to side and that. Very good. Okay. And now I'm gonna look inside your mouth again. So just open it as wide as you can. Everything looks good there. Okay. Now I'm gonna take another quick look just to double check my work. Very good. Okay. Now I'm gonna stick this in your mouth. You're just gonna test out your reflex. So if it hurts or anything like that, just pause.
October 21st, 2016, and we are doing the oral mechanism exam, and I'm the examiner, Camille Molineux, and this is my examinee,
Mary Griffin.
Hi Mary, how are you doing?
Good, how are you?
Good. Okay, so today I'm just going to be asking you to say some sounds. I'm just going to be looking at your speed and your lips and how everything works together, okay? So the first sound that I want you to say is puh.
Puh.
Yep, and then I want you to say it as fast as you can. Puh, 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 puh. Can you do that?
Puh, 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 puh.
Good. Okay, now I'm just going to ask you to go, and then whenever I say stop, you're just going to stop. So I just want you to do it as fast and as accurately as you can, okay? Okay, ready, go. Good. Good job. Okay, now we're going to do the same thing with ta, okay? So you say ta 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 ta. Can you do that? Okay, ready, go. Good. Good job. Okay, now we're going to do it with ka. Can you say ka? Ka. And then I want you to do as fast as you can again. So ka 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 ka.
Ka, 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 ka.
Okay, ready, go.
Ka, 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 ka.
Good. Okay, now we're going to put those sounds together and say pa-ta-ka.
Pa-ta-ka.
Yeah, and I want you to do the same thing as before and say it as fast as you can, okay? Ready, go.
Pa-ta-ka, 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 pa-ta-ka.
Good. Good job. Okay, we are all done with that. Now, I am going to be putting on some hand sanitizer. And we're going to be looking, I'm going to be looking at some features of your face and some things that you'll be doing, some movements, and then some other things. I'm just going to be asking you some easier things like just having your mouth open and stuff like that. So I just want you to do the best that you can, okay? So the first thing that I'm going to do is I'm just looking at your face at rest, so you can just sit still. And then, and everything looks very symmetrical, your face. There's no drooping to either side. Everything looks good. Okay, can you open your mouth? And then close it. Open it again. Close it. Good, I don't hear any clicking. Everything looks good. Okay, I'm just going to look at your mouth. You say, ah. Ah. Good. I'm just looking at your teeth. Can you smile for me? Good. You have some pretty teeth. You're welcome. Can you stick your lips out like you're going to kiss? Do a kiss face? Good. I'm going to put this tongue depressor on your lips, okay? And I want you to, I'm going to try and press it back, and I want you to keep it strong, okay? Good. Okay, now I want you to smile. Good. Can you go back and forth, pucker and smile? Good. Okay, I want you to hold air in your cheeks like you're gonna blow a bubble, okay? So I'm gonna press, and I want you to keep me from letting that air out of your cheeks, okay? Good, nice strong hold. I'm gonna put this mirror under your nose, same thing, yep. I'm just gonna be looking. Good. Okay, when you open your mouth, I'm just gonna look at your tongue. So you stick your tongue out, good. Now, open your mouth. Good. Okay, can you stick your tongue straight out for me? And stick it back in. Good. Okay. Can you stick your tongue out? And I'm going to be putting this tongue depressor on there. I just want you to keep it strong, okay? I don't want you to let me put that in. Good. You stick your tongue out, stick it back in your mouth, and out, in, go. Okay, can you put your tongue tip to the left, and then the right? Okay, can you stick it to the left again? I'm gonna try and put this over here. I want you to keep it strong, okay? Okay, can you do it on the other side? Okay. Good. Okay, can you go to the left and the right? Can you go back and forth? As fast as you can. Okay. You stick your tongue up and then down. Good. Okay. You should be looking in your mouth. You say ah, ah. Good. You stick your head back a little bit. Good. You say ah,
Ah.
do it again.
Ah.
Good. Okay. And the last thing we're going to do is be sticking this inside your mouth, and you're going to feel kind of like a gag reflex, and it might just make you so that's okay if you do that, okay? Okay. Okay, we're all done. Mary, good job.
Thank you.